Hi, my name is Srijit Jeevan and I'm a designer.
Hi, I'm Anuda Kunath. I'm a filmmaker. We just had our second baby at Birthvillage.
Whenever we talk about birthing, whenever we talk about pregnancy, an emotion that I associate with it a lot was fear. And I think that's also because perhaps as a man, there is so much that you don't know about. There is very little information about pregnancy or mother care or delivery that we get to learn or even as a part of the whole process.
First time around, we were very happy with our care provider, but it was the labor room experience that was very traumatic for me as a first time mother, especially. Um, it was like I was actually told, in fact, that everyone labors and everyone's been pregnant. You don't need to scream so much in labor, and it was just one of the first of the many things that I was told that was very shocking for me, and I was very uncomfortable at that point when you're like laboring and then you're experiencing contractions for the first time. You just want to vent. Um, I mean, at that point, getting yelled at is the last thing that you want. No one. Also, you're surrounded by a couple of strangers. Whatever said and done, you don't have. I mean, Srijit wasn't allowed to come inside. My mother hadn't, landed yet. My water level was low. It was when we went for an appointment that we came to know, and I was immediately rushed to the labor room. So I had to ask, what is it? What is going to happen? But I was quickly like ushered, and they said you have to be admitted. That's it. That's all the information that I got, and I was given an injection, and I had to ask a couple of times like, what is this? Like, what does it do? So I mean, then later they told me that it's for the child's lungs to develop in case they have to do an emergency C-section and all that. So thankfully, it didn't come to that, and so a lot of experiences like this, by the end of it, I was completely averse to going into an institution um, for the delivery. A lot of close friends have had their babies at Birth Village, and they've only had good things to say. Our appointment with Priyanka, I think, lasted for almost an hour,
Yeah, almost
and
enough.
she was, very forthcoming. She was very patient, and she was. It was more like a counseling session, I think, for us, where we were so much at ease by the end of it, and we were not just talking about like the medical aspects of it, of pregnancy, but we were talking about like our fears, our expectations out of this, and what is our comfort zone, what is it that want out of this.
First appointment with Priyanka that she'd asked about how I felt about pregnancy in general, and that was also the first time that somebody had asked me this question because otherwise it was always about the mother, and which also sort of made me question where a lot of the thoughts around pregnancy or childbirth comes from, and it was sort of like a brainstorm, which was also like a mind mapping for me, and yeah, I think that sort of really helped to you know relax the whole process.
In my 37th week, I my water started leaking, and I immediately rang up the medical team, and they put me through to Priyanka, and then we discussed. Then I went in, and we realized that I was having a hind leak, and which was that my water hadn't completely broken, but it was leaking throughout the day, and it was a situation where we got a little tensed hearing this, because usually during pregnancy, like your water breaks, and then you go into labor, but I wasn't getting my contractions then, and very sweetly, like the medical team was on their toes. So they said, you can call us anytime, even if it's at like 1 or 2 in the night, if you have any doubts, if you have any concerns. And so we met with Priyanka. So she informed me that, this is what it is. It is not something that you need to panic about. There are certain things that we need to keep an eye out for, which is basically if the color of the water changes or if the child is in distress. So we came in every day for the next few days to, for a CTG, to checking the child's vitals, the heartbeat, and all that, and it was fine. So then Priyanka told me that in a normally an institution would wait for 24 hours, maximum 48 hours. And outside of India, there are cases where they have waited up to 72 hours. In this situation, what I would say is that, as long as the child's vitals and you are fine, we are ready to wait. And the decision is completely upon you. And if you feel like it's taking a toll on your mental health, that it's been 4 days and your contractions haven't started and it's taking a toll on you, then you can tell us that, okay, I'm done waiting. We can go in for an intervention. But until and unless you tell us, we are not going to do anything, and we completely stand by your decision in this. And that was something that was so amazing that it took me a while to process that there is my midwife who's telling me that she'll support my decision. And so when someone's telling you that you are like, what do you say, what you're feeling is legit, what your gut feeling about your own body is, that is something so amazing that I felt so empowered. So I said, okay, I feel like it is taking a toll on me, but I feel like we should wait. I'm, as long as the baby is fine, I'm ready to wait. So she said, okay, we stand by you in whatever decision that you're taking. And then I think it took more than 4 or 5 days, more than the amount of time that there are recorded cases for. On Saturday morning, I was telling Srijit, like, I think this might progress. So we called in the medical team and they said, okay, so if you want to wait, you can wait, or if you feel like you want to come in, it's up to you, you can come in. We'll inform Priyanka. So then we slowly went and had breakfast, and I think I had 3 mild contractions over the course of the breakfast. And then we set out to Birthvillage. And after I got here, I was there was a pelvic exam. That was the only pelvic exam, and with my consent. So when you're meeting people and you're pregnant and they just come and touch your tummy, but here I was being asked, we are going to feel the baby. Are you okay with me touching you? So, so there was my first pelvic exam, and I was only 3 centimeters dilated. And on a usual day, you're sent back till you're at least 7 or 8 centimeters, I guess. So, but because of this whole, like laboring through the week situation, Priyanka said, let's just see, let's see how fast you progress. After 4 hours, we had our baby.
A week which would have otherwise been hysterical and traumatic for us, I mean, physically for her and emotionally for me, turned into something sort of spiritual and sort of emotional healing, because we were coming in to take the CTG, and every day we would discuss about why the baby wasn't coming out. And so we were asking ourselves emotional questions about, would this perhaps be the last pregnancy? Is that why you don't want to push the baby out? Or are we waiting for something else to complete itself, that the baby can then come out. So it was so interesting that we were going back with, like, questions that were sort of self contemplation and spiritually elevating. So we weren't really like coming into a hospital and going back with medical trauma. We were, we were praying, we were seeing what spiritual part of us needs improvement. So it was interesting. That week was quite interesting. I mean, if I have to write a book, then that week will feature definitely in it.
It is wonderful to have, Srijit beside me while I was laboring, and to have my son with me in the same room is something that it wouldn't have struck me that this is an option. And I think we over prepared him, because when Priyanka said that you can, like, the sibling can be there at the time of birth, I slowly, I was showing him photographs that Birthvillage has put up earlier on their page. So on the day of, the delivery, he was there. He was taking walks with me. He was helping Srijit rub my back initially, and then once the active labor starts, I think it was a blur for me. Then I don't remember what is happening. And later, when I was looking at the video, I realized he was so, he was so, I think, over prepared. He was so comfortable in that situation that he had snuck out and taken Srijit's phone and propped it up on the sofa, taken a box of chocos, and he was, you know, watching a video and eating while I was laboring. And once the baby came out, they said, like, you have a baby brother. And then he jumped in and he was so happy. And he was so happy to be the person to cut the cord.
I think for us in this pregnancy, what was really different was that the whole process was very poetic. From the process of just saying that we are going to make a child, the entire pregnancy was very poetic, was very romanticized. It was spiritual. It was emotional. It was so many more things, because I think we saw the whole journey in a much more holistic manner than just looking at it as the medical procedure of making a child. And like, for instance, if I have to give a metaphor, it's like saying, from somebody who says, I find cooking very boring, to being somebody who says cooking is therapeutic, So I think that is probably what I mean. We don't advise, because or every journey is different, but I feel if there's one tip that we can give parents who, people who are going to be parents, the advice is to really indulge in the process, like immerse yourself in that experience, because it really is holistic. It's very spiritual if you look at it in that way, and it's a lot more fun than you can imagine, and it's a lot more wholesome than it having to be traumatic.
I think that's also coming from the fact that we were not kept in the dark about anything, and not just me, but also to Srijit, like, whether it's appointments or attending classes, we were equally, spoken to and informed, and there was so much dignity in everything that was done for us. And I think that like drew out like a stark difference for us from our previous experience. Empathy and care should be the norm. You are entitled to have all the information that you need to be passed on to you without fear, and to make decisions about your own body. This is my message to everyone who's looking forward to becoming parents.